I'm a brain injury survivor and a rape survivor. Back in 1989, I was living in New York City, and I went out for a run in Central Park after work, and I was attacked. And I was beaten, raped, and left for dead. And I became known as the Central Park Jogger.
We are so glad to have Tricia here to share her message of resilience, hope, possibility, and healing. This conference is about raising awareness of traumatic brain injury and CTE in women. This is an area that is a huge gap in the world of research. A lot of the attention and a lot of the research funding goes toward studies that focus on male athletes, and consequently we just don't know as much about women who sustain a concussion. And there are countless circumstances under which women are exposed to repetitive subconcussive head trauma, contact sports being one of them, military service, women who are victims of domestic violence experience similar exposures to male contact sport athletes, but we don't hear about them. And we're not researching them well enough, we're not learning as much as we could. And since in the research that has been conducted in traumatic brain injury in women, we know that the injury mechanisms differ, we know the recovery trajectories differ, we cannot assume that what we know about traumatic brain injury in men is also true for women.
CTE is chronic traumatic encephalopathy, and it's a neurodegenerative disease. First symptoms arise, it's changes in mood and behavior, also changes in cognition and memory. It can occur as a result of multiple subconcussive or concussive events.
In the early 90s, we have a case, a very strange case, of a young patient who had very severe autism, had that very severe behavior where she would bang her head on anything and everything, so walls, tables, other people. It was an extremely severe case with autism. An autopsy was performed when she ultimately passed away. We looked at this brain because there was clearly repeated trauma for many, many years. And that was the first, one of the very first cases documented of traumatic brain injuries with lesions compatible with what we call now chronic traumatic encephalopathy in a woman.
In collaboration with Dr. Sam Gandy, we ventured on an imaging study to look to see if we can see tau in a living brain doing positron emission tomography or PET scans. And so there's a radioactive tracer or a ligand that is specific for this tau protein. It's injected into the body, and then when it allows to circulate, it will bind to any tau that's in a person's brain. And so we're hoping with this sort of nuclear medicine technology, we can help diagnose people with CTE, since the clinical symptoms present in a lot of degenerative diseases and similar to post-traumatic stress disorder. So this way we can see, is there tau in your brain and where is it in your brain? Because it'll be in different parts of your brain than it would be, say, in an Alzheimer's disease patient. Having a scan where we can see tau in your brain, in addition to just helping with diagnose, it can also look at drug efficacy. And if we see less tau in the brain with the drug, maybe this drug is a good drug.
I'm definitely more hopeful for the future because I think there is now an awareness that there hasn't been a lot of time and energy and research dollars devoted to brain injury in women.
We wanted to bring together the women who are living with brain injury to kind of put a face to what it is that we're talking about. We wanted to bring together the researchers to share our current knowledge, to highlight some of the gaps in our knowledge when it comes to understanding brain injury in women. And we wanted Tricia Miley here to share with our entire audience her message of hope and resilience.